Everybody, or good afternoon, good morning, depending on where you are tuning in from. My name is Simon Ramshaw. I'm the Managing Director of Erchonia Lasers Limited, who are the official distributors for Europe, Middle East and Africa for the full range of the Erchonia lasers. Thank you again for your time. I know for the UK specifically, it's approaching dinner time, or as in Martine's case, yoga classes a little later on. So without further ado, I would like to introduce you to Martine, who I've been luckily enough to know since 2012. She was the first clinic in the whole of Europe, actually the whole of the world, I think, to actually have the Lunula laser in the London Nail Laser Clinic. She is the founder, the director and lead podiatrist at the London Nail Laser Clinic. So to give you a little bit about Martine's background before I formally introduce her, she qualified from the Birmingham School of Podiatry in 1996 and spent the first 10 years of her career in the NHS in London before working private practice. In 2009, Martine set up the London Nail Laser Clinic with the sole aim of treating fungal nail infections using the latest laser technology. The London Nail Laser Clinic's always been proud to offer patients the most leading edge equipment available, and they've been using the Erchonia Lunula laser since 2012. I think there's been 8 lasers in total. But in addition to running a busy clinic, Martine took on the role of clinical consultant for us, enabling us to be able to share absolutely every experience that she's had in the probably 8,000 or 9,000 patients she's actually treated with the Lunula laser. So I don't think there's too much that you don't know, Martine. Would you agree?
I'm always learning. It's always good to learn, but hopefully I've seen enough. I'll retire.
Well, on the serious note, we owe Martine so much. Lucky enough to become a friend as well as a colleague with Martine, and got to know her extremely well over the last 13 years now, and time flies. And again, her knowledge is just, way off left field with regard to not just, following what you'd say is standard practice, but thinking outside the box to try to get her clients, the best results possible. And a lot of the time we have to look beyond conventional medicine with this. We have to look holistically for the good of our clients, but also understand with regard to this type of treatment as well. Excuse me, it's not a miracle. It's the main part of a treatment program, but by no means is it the only part. It's how to integrate it into your practice, how to maximize your own individual skill set and combine that with the use of laser and putting the right processes in place. And I think over the last 13 years, you've got it off to a T, Mrs. Silverman.
I hope so. Otherwise, it's been one hell of a waste of time.
It has, yes. In case anybody hasn't been on these calls before, we do quite a few webinars, but you'll notice down the right-hand side, there's a question section. Please ask any questions you have in there. Martine's happy for me to interrupt her as we go and look for an opportunity to put the question forward. Or if there's anything that we don't get round to asking, I will ask Martine, and then we can send it through to you via email afterwards. And you will all receive a recording of this video as well, so you'll be able to go back to it anytime to if you want something repeated. So I'm not going to babble on for any more. Martine, the floor is yours. Over to you. And I'm going to mute myself and take my video off so you have the stage.
Thank you very much. Okay, right, I'm just going to get hopefully rid of you. No offense. Hi, everyone. So yeah, as Simon has said, I have used Lunula for over 13 years. When I started using it as per Erchonia's protocol, and it was kind of a couple of treatments and keep checking and seeing what happens, and it was very much fungal based. So whilst this webinar is called Revolutionising Fungal Nail and Skin Health, I'll just let you into a little secret. Probably 80% of the patients that I treat do not have an active spreading fungal infection. So we'll kind of look at that in a moment. But I probably don't really need to tell you a great deal because Simon has just told you all about me, but I will just tell you that over the last 16 years, my focus as a podiatrist has been nails, really, more than anything else. The reason being that after 10 years in the NHS, I kept dislocating my right thumb by enucleating corns and debriding callus. And so I wanted to do something which wasn't going to harm my joints quite as much. And actually, my thought back in 2009 was come out of podiatry completely, and I did an introduction to counselling course, but then came upon pinpoint foot laser, which I'm sure many of you have heard of, but if you haven't, it's a thermal laser, hot laser, and I used that for 3 years and pretty much hated every minute of it because I don't really like causing pain, and my patients were in pain because there was an awful lot of heat. And then in 2012, a friend of mine told me about a website that had this little picture of a box on it that had a couple of lights and said something about fungal nails. And I sent an email, and that was kind of the start of my Lunula journey. And now, over 13 years later, I'm a really huge fan of cold lasers. I generally only use Lunula. I do have PL Touch, one of the pain management lasers that I kind of use here and there, but not a great deal. And that's just because I don't have time to learn enough really to use it confidently. But I'm a huge fan of all of the Erchonia lasers. I've spent time at various conferences with various doctors, chiropractors, a whole host of different disciplines in the States or from the States and Europe and Middle East. And I find the whole concept of cold lasers really incredible. So yeah, I'm kind of going to pick up Lunula today, which I guess is why I'm here. So this is actually from Erchonia's website. Erchonia's Lunula laser is the only fully automated machine for treating nail fungus and the only cold laser therapy device to be FDA cleared for fungal nail treatment. That's absolutely great. For those of you who don't know, and I'm sure most of you, or if not all of you, do know, FDA clearance is what they have out in the States. The Lunula is manufactured out in America, and in order to use it for public use, you have to have FDA clearance. We have the European kite mark, and everything is falls under all the safety regulations. However, I'm not American, so when I use Lunula, I don't just use it for nail fungus, and I will explain a lot more about this as we go along. But just for those of you who are at all concerned that perhaps there hasn't been research into it, there has. It's got the 510K market clearance out in the States. It's absolutely safe. It's very effective, and patients love it as much as I do, pretty much. Mainly because it's painless, unlike the other lasers that I used to use. So we will talk a little bit more about what we're treating first of all before we talk about what we use to treat. So when a new patient comes into my clinic, I don't just look at their nails, I look at them, I look at their shoes, I discuss their lifestyles, I look at their general health, I look at their local health, foot health, circulation, neurological state, all the different things that as podiatrists we're meant to look at. If anyone on here is not a podiatrist, you may well do things slightly differently. The reason that I look at it is not because I'm concerned that if I use Lunula, I'll cause a problem, but because I want to put a package together for my patients. I provide a service to them. Lunula is part of that service. Lunula does what I can't do, but as a podiatrist and as a human being, I can do what Lunula can't do. And then there's a little bit extra that the patient needs to do. So we look at what we're treating, who we're treating, their health, medication, circulation. The only times I won't use Lunula is if someone is pregnant, not because it is going to cause any harm, but because pregnancy is excluded from clinical studies, and so I don't have it in black and white that it's safe. I'm fairly sure it is. I'm also fairly sure that I have used Lunula on women in early pregnancy before they have known they're pregnant, and obviously before I have known they're pregnant, and all has been fine. However, I tend to make a point that if I know someone's pregnant, I won't use it. If I know someone is breastfeeding, there's no problem at all, can absolutely use it. But pregnancy, new scarring, I won't use it because new scarring shouldn't be subjected to light like that, or UV light for a good year or so. And if I have a patient who has photosensitivity, we'll discuss, but I probably will treat. I've treated many. If I have a patient who is immunosuppressed, I will treat. I've treated many. Sometimes it takes a bit longer, but essentially I'm getting a picture of my patient so I can determine not just what the best protocol treating them is, because I have different protocols for different pathologies, but also I can determine whether I think, are we going to see a change in 6 months? Are we just going to see regression because their circulation is so poor? Is it worth them spending money? And it is really a financial commitment. Lunula is essentially the only treatment that, well, the only treatment I offer in clinic, because I am a podiatrist and so occasionally I do treat other things. But apart from sort of routine podiatry, Lunula is what I use for all kinds of nail problems, many kinds of skin problems, improving patient circulation, stimulating healing. That's kind of what it's all about. So if we look at nails, which is generally why we use Lunula, and you need to remember that Lunula is a box that you put a hand or a foot in, so there's only so much that can actually fit into that box. So generally nails or skin are the two things that we treat. So, when I look at a patient's nails as they come in, I want to work out where the problem is. And usually the problem is at the hyponychium. There's been, the seal has been broken. There is no distal border anymore. The digit is starting to sort of bulge and the nail is not sitting on the nail plate properly. Quite often it's not attached. So I'm looking at all different things: discoloration, splitting, those lines, detachment, damage around the nail area, all these different things. Whether there's signs of infection, whether there's signs of bruising, whether there's apical callus, because 9 times out of 10, if there's apical callus, there is damage to the distal end of the nail as well. And then I look at the skin. Most patients don't have too many problems with their skin. A lot have very dry skin. A lot of those who have dry skin will have chronic tinea so there will be some fungal involvement, but it's not itchy. There's no little red spots. There's no real red border, but it doesn't look like just dry skin or callus. It has a particular look about it. A lot of the younger people that I see, by younger I tend to mean post-pubescent up to probably late 30s, their feet tend to be incredibly clammy, sweaty, hot, and they are the ones who often have the fungal infection rather than just just damaged nail and damaged skin. So I look also, obviously, at circulation. I feel whether they're hot, cold, think about what the temperature in the room might be, what it's like outside, and I'm putting a picture together to determine what sort of treatment I want to be doing. So Additionally, for fungal infections, for onychomycosis, topical application, systemic medication, surgery, LED and thermal lasers. I haven't found any of these particularly useful as a whole. And the reason I say as a whole is because they're actually all, maybe not so much LED, or surgery, but the others are great for killing off fungus. Topical applications do what they say on the tin. They kill fungus. If you've got fungus sitting on your nail plate, it will kill the fungus. Systemic medications will probably help at nail matrix and nail bed too. And same as thermal lasers, they're there purely to heat up the area so any fungus dies around 56 degrees or so. But they don't actually heal the area. They don't heal the damage that's there. They don't stimulate the body to heal itself. So what tends to happen if you've got a patient in who's had a problem for many years, that these things aren't going to help. After about 2 years of having a nail issue, a lot of these won't get rid of the problem completely. The only thing that I would say has half a chance is systemic medication, and most of us will know the downsides of that being the side effects that come with it, ranging from at its worst liver damage and probably at its least bad stomach or losing sense of taste or feeling a bit depressed. And usually things will go once you stop the treatment, but a lot of patients, in my experience, don't use the medication long enough if they get side effects for it to have an effect, or doctors don't prescribe it for a long enough period of time because they're worried about toxicity, and patients will take it for a month, 2 months, maybe 3 months, and then they come off it and everything's looking quite nice. 6 months later, it all flares up again, a little bit like only taking half your dose for a throat infection. You know, a little while later, your immune system will be a little down and everything will flare up again. So I do have some patients where we combine systemic medication with laser, with Lunula, but I can probably count those on my hands, on my fingers. There's not that many of them. So let's talk about how lasers work. I said about pinpoint, that's one I know best. There are plenty of others. And with thermal lasers, quite often they tend to treat a whole variety of different things. You know, verrucae, onychomycosis, they might help with neurovascular corns, lots of different things. Yeah, that can be a plus point, I suppose. However, sometimes, you know, they're jack of all trades, master of none, in my opinion. And it really is my opinion. If you haven't tried them yourself, you know, speak to people who have. But thermal lasers are used to heat up the area, as I said before, so that anything that's under there will just die. And, you know, they can cause damage because they're destructive. That's the whole point of them. And you don't get a photochemical response. We'll talk about photochemistry in just a moment. So non-thermal lasers, which are what I use, Lunula, they work at a completely different level. They work on live tissue. They don't really work on, you know, if you were to use a thermal laser on, you know, a piece of paper, you end up burning through the piece of paper. If you put a piece of paper into Lunula, the piece of paper will come out exactly the same. So they work on a very different level, and I tend to think of them as similar to how the sun works. So when you stand out in the sun, you have your receptors in your cells, the photonic energy, the ultraviolet rays from the sun are taken up into your cells, and we'll make the story very short, your body produces vitamin D, which keeps you nice and healthy. With Lunula, it's not UV light, and I will go through and show you where UV is compared to the visible beams that we use. But they also work at cellular level. They don't generate heat, and in fact, whilst the sun is obviously a ball of fire, the UV rays that come off are not hot, technically, themselves. Lunula is also made to, I didn't do any of the research on it, I'm not a physicist. However, it was produced by people who know an awful lot more than I know about physics and about biology. But I see the result of this in a 12-minute session. It's quite incredible what difference you can see a few weeks later when things start to grow. And the healing part of it is something that I haven't found in any other device, tablet, oil, paint on, anything like that. How our bodies respond to something as simple as light, but obviously light keeps us alive anyway. But it's quite incredible seeing it. And when I started using Lunula in 2012, having been using Pinpoint, we had the whole no pain, no gain thing. And I had many, many sleepless nights because if I wasn't hurting someone, surely it wasn't really working. However, I'm pleased to say that it does work and you don't have to hurt anyone. So non-thermal laser. So you look at the picture and you see visible light. When you get to infrared on the left, that is no longer visible light. When you get to UV on the right, that is no longer visible light. But visible light is exactly what it says. It's what you see. And it fits into the electromagnetic spectrum bang in the middle of high energy and bang in the middle on the other side of high heat, and lower energy. So the hotter something is, the less energy there is, and the colder something is, the more energy there is. So photochemistry versus photothermal responses. Photochemistry, Lunula, is we don't have the heat and it stimulates the body to produce nitric oxide, which improves the circulation. This is from the red beam, and I will show you in just a moment the red and the violet beams and their differences. It also enhances collagen synthesis and tissue repair. With a photothermal reaction, so the 1064 nanometer devices, there's many of them around. There's also some that are sort of 900 and something odd nanometers. They need a lot of power. They're high power machines. They're quite big. To be fair, they probably look far more impressive than Lunula does. I like to think Lunula is cute and sort of small and mighty, whereas some of the others are very big, cost an absolute fortune and really damage the area when they're used. They destroy the cells that are there. We don't want that. We just want to stimulate new cells and make things regenerate and end up with nice new nails, nail beds, nail plates, nice healthy skin. So it's a chemical reaction, one that's obviously initiated by the absorption of energy, as we said, in the form of light. And the consequence of the molecules absorbing the light is that they become really excited. All the little mitochondria in our cells become very excited and sort of chat to each other and start a chain reaction going. So there is something called the Harvard study on photochemical energy, and we use in Lunula the 405 nanometer diode and the 635 nanometer diode. And 808 nanometer diode is going up to infrared, so it's a lower energy one. 405 produces just over 3 electron volts per photon, and the 635 produces just under 2 electron volts per photon. Whereas when you get over 700 nanometers, you're not getting that same amount of energy, so they're not working in the same way. How they work, so they target in the electron transport chain, they target the red laser 635 targets complex 4, which is cytochrome C oxidase, and it enhances the cellular respiration in order to get nitric oxide. Nitric oxide is a powerful vasodilator. Powerful vasodilator means nice blood supply in the area, a lot more than we generally get, particularly in our toes. And then it can start regenerating and get an immune response kicking in quite nicely. The violet 405 nanometer diode generates 3 electron volts per photon, just over that, and targets complex 1 and 2. So you get NADPH oxidase in the electron transport chain, and therefore you're going to end up with hydrogen peroxide, which I think most of us will know is an antimicrobial, and certainly in years past, and some people now will paint it on top of the nail plate, and it will get rid of or break down fungus there, but we need it to be inside. We need it to be in the live tissue rather than the dead nail plate, because you could probably just wipe an anti-bac wipe over the top of the nail plate to kill off anything that's sitting on there. So Lunula on the left here gets fired up, works for 12 minutes, and that then gets taken into or gets taken up by the photoreceptors, so the NADPH oxidase and cytochrome C oxidase. And when that happens, you get your primary response, you get your reactive oxygen species and your ATP, your adenosine triphosphate, and ROS from the red beam. And then ROS is converted into hydrogen peroxide, and ATP is converted to nitric oxide. And that's a really simplistic way of explaining it. There is an awful lot of research that's been done on photochemical reactions. It is online, lots and lots have been explained in real depth. To be honest, I get lost after a couple of paragraphs, but this is very easy for me to understand that, you know, the body goes through different reactions or different responses to light. Very simple. So they work in tandem, and in, well, it was probably the latter part of 2020. So once I'd reopened after the first lockdown, I had a patient come in who was a young lady of, I think she was 22 at the time, and she had multiple sclerosis. She was in a wheelchair. She had really dreadful nails, but she had ice cold feet, and it was like touching an ice cube. They were so cold. And because at that time I had just bought my surface thermometer into clinic, I had decided already, and having spoken to her, that using Lunula to get her nails into a better state was probably going to be a bit of false economy for her, because her circulation was so poor, she wasn't able to walk very much at all. And in fact, in clinic, she didn't even get out of her chair and into my patient chair. I carried out her nail care while she was still in her chair. And I just didn't feel that carrying out Lunula was going to be a good long-term thing for her. I didn't think it would help enough at that point. But I did carry out one Lunula treatment for her that day because I wanted to just see what happens in terms of temperature. And her right foot increased, I think it was 1.2 degrees, and her left foot surface temperature increased by just under a degree. So it was quite interesting. It was almost immediate, you know, within 5 minutes of coming out of the device. So it was really quite interesting. And I couldn't really attribute that to anything other than Lunula, because she was sat in the same position that she sits, you know, most of the time, unfortunately. Feet down, you know, there she hadn't been walking around, she hadn't suddenly, you know, got up and walked from the chair, from the patient couch to, you know, a different chair. There was no change in anything except having Lunula. So certainly it does increase the circulation. I will show you a picture in a moment of a Doppler, which will, some of you have probably seen it. It's not my picture or my pictures, there's two of them. that I'll show you in a sec. But essentially, a lot of patients who come in with sort of fairly poor circulation, when they sit with their feet in laser in Lunula, and then they sit there and their feet go in and they look quite pale, they're not particularly warm. When they come out, they certainly do look better colour. And patients have said to me quite a few times that their feet just feel healthier. It's not even to do with their nails at that point, it's really to do with their feet in general. So I tend to use Lunula now with patients who are prone to chilblains. We might carry out a monthly treatment before we get to the winter, and then take you through the winter. With patients who ski, although we do put other things in place for them, such as waterproof socks and a few other bits and pieces to dry their ski boots. But patients who just generally have pretty dire circulation, it tends to help. Now, it does only help temporarily, but if you do it at the right time of year when the circulation is really very poor, it makes them have a much nicer winter. So laser is used to heal, to regenerate, to just make things much healthier. The violet laser is the antimicrobial one. So whilst you do get obviously your immune response with the red laser, violet laser that's what it's there for, and it's used with other Erchonia lasers for things like acne and lots of other infections and things that I don't treat in clinic. So together, the two of them work very nicely. So Lunula and nitric oxide. Well, we know that nitric oxide leads to vasodilation and increased circulation. So the top picture is prior to Lunula treatment, and the bottom picture is post a Lunula treatment, and you can see there is a significant increase in the blood supply there. If you think that when you carry out a treatment and you end up with a buildup of more blood supply, better blood supply there, and then that takes a while before it gets back to normal. If you leave time in between Lunula treatments, you will then increase that blood supply an awful lot. If you keep treating very close together, you probably won't increase the blood supply quite as much because there's only so much nitric oxide the body is going to be able to produce. And hydrogen peroxide, well, we know that H2O2 breaks down fungus. It disrupts the membrane, cell membranes, and interferes with the metabolic process. We've been using it for years. I think usually about 3% we tend to use. It's very difficult to treat under the nail plate. People do obviously fenestration, but not usually with hydrogen peroxide. You need to be quite careful when using it. But if we are producing it naturally within the body, so treating from inside out, and apparently we produce 25–30% more hydrogen peroxide than we would normally have in the local area, then that's a huge amount, which is why Lunula is incredibly effective at breaking down fungus. So I've kind of gone through most of these already. There's a whole load of reasons why I prefer Lunula to other treatments. Fairly often my patients come in and they have tried almost everything else and they're not happy. They haven't had a particularly good experience with either topicals, with systemics, with various other lasers, with fenestration. I've had quite a few patients who have come in, haven't had fenestration, and it's been quite difficult for them. This is something that they don't necessarily believe is going to work at first. And sometimes, you have to really manage expectations. But generally, on the whole, I get improvements with every patient. I'm not, someone who kind of beefs something up for no reason whatsoever. And I have had times where, particularly with proximal infections, very difficult to treat. and you'll see one of my cases that I'll show you in a moment. It's taken one hell of a long time, but it looks like we have just cracked it. Patient emailed me a photo today, which is what prompted me to put it into this webinar. I'm quite excited by it, but I think Lunula, I'm really surprised after all this time that no one's kind of ripped it off. And I have patients who try the sort of Amazon, UV light or little red light stuff. None of it works compared to Lunula, because when you're treating someone, you're treating the whole person. You're treating not just their nails, but their socks, their shoes, their lifestyle, their health, all these different things. So it's a great thing to have as an addition to your clinic. So if we just look at, I'm going to go through this quite quickly, but if you're using something that's helping you to heal and making everything better, then you want to try and get rid of the reason for the problem in the first place. Now, we don't always know the reason, but quite often, and in most cases, patient walks into clinic and I can see the reason straight away. They're wearing shoes that are too small, or they've had gel nails put on, or they play sport and are wearing inappropriate shoes. So you need to manage risk factors, or they're older and their health isn't quite so good. So that's where podiatry comes into it for me. Everything that I learned 30 odd years ago when I was a student, more than 30 years ago when I started my degree, and then skills that I've honed over the years. I think as a podiatrist, I have a massive advantage over other people who use Lunula, because I think in terms of the health of the area. I don't think in terms of making nails just look better. I talk about the whole health. So when I train people who aren't podiatrists, we talk about this quite a lot, and hopefully I'm successful, but I try and get them to start thinking in terms of patient's health, foot health, nail health, skin health. And foot hygiene, I have noticed over the years that people who don't keep their feet dry, so not necessarily people who don't keep them clean, but certainly people who have sweaty feet, wet socks, wear the same shoes and socks all day, every day, and it looks like they've got dry skin, so they put a whole load of oil and moisturizer and stuff on, so they're not keeping anything dry. All these oils that you can buy for nails soften the nail and start to eventually detach it. If you've got tinea pedis, if you've got athlete's foot, then using moisturizer cream is just going to make it worse, because fungus loves moisture. So it's all about educating your patient. I had a patient who came in, I think the week before last, it was, I think, and he was a new patient, and he only had one toenail that is a problem for him, has been for, I think he said about 10 years. His skin looked great, and he said to me before I could even ask him about, his lifestyle and what he does, he said to me that at the beginning of the summer, he started to wash his socks on a really high temperature. And that's the only thing so far that had stopped his skin from flaring up. And I said, your skin's fine. He said it wasn't. And he actually showed me a couple of photos of what his skin had been sort of April, May time. And it was really awful. And he said he tried Lamisil cream, he tried that Taran cream, he tried this spray, he tried that powder, that it would go for a couple of days and it would come back again. And it was only actually when he read something online about you should wash socks at least 60 degrees that he thought, I'll give it a go. And he said within a week, his skin was an awful lot better. So I think that's, quite validating, quite nice. Diet and nutrition. Well, there's an awful lot around about protein intake at the moment, and collagen, and omega-3s and all these different things. Personally, I take a few supplements in there. I'm now in my 50s, and I eat a lot of protein. I feel far healthier than I did a year or so ago when I ate a lot of rubbish. I take vitamin D every day. personally, I don't find biting does a great deal, but I do now have to cut my nails very, very often, which is really annoying. But they're really, really strong. My hair is pretty strong now. My skin is good. So there's a lot to be said for diet and nutrition. I have always been someone who, when asked, do vitamins help, said, I don't know. Anyone can sell a supplement. The rules for making and selling them are very different to medicines. But actually, having used things for a year or so, I do think that there is something in it. So I talk to my patients about diet. I've found, certainly since COVID, a lot of patients have a lot of gut problems. And we know that, a massive amount of our immune system is in our gut. So, I eat sauerkraut every day. First of all, I love it, but secondly, fermented food is very good. I've realised as I've got older, I'm probably now lactose intolerant, so I drink very little milk, occasional cup of tea, but really very little. I do have a bit of cheese, but I don't tend to have much yogurt or anything like that anymore. So we change as we get older, and I think that the cause of people's nail problems are probably not diet and nutrition based, but it's not helping to improve the health of their nails if they don't look at all these different things. So it's just something else to think about. When I think of Lunula, and in fact when I think of all of Erchonia's products, I think of good health, and that's what they're there for. They're there to stimulate good health, healing, regeneration. So circulation and exercise for healthy nails. Well, we need to try and keep blood flow going. I often say to my patients, I ask them not to put anything on their nails. If they have athlete's foot, if they have acute athlete's foot, I'll ask them to use a combination of Lamisil, Dactar, and Intotrimasol. If they don't, I will give them a Clinicep spray if it's particularly warm, or they do a lot of sport, or they're sitting in an office all day and they can just go at lunchtime and give their feet a wipe and change their socks. But essentially, in my mind, if we're trying to improve the circulation, when you come out the shower and you dry your feet, massage them a little bit, get the blood flowing a little bit more. But the opposite side of that is tight shoes and socks, which have a tourniquet effect, and they push the blood supply away. So it's really important that patients start to understand what's going on in their bodies. It's not enough just to say, oh yeah, you've got a fungal infection, okay, stick your foot in here and it will all go away, because that's not really how it works. They're a person with all bits and pieces inside. And combining Lunula with lifestyle changes. Well, this is what I do, Lunula, lifestyle changes, podiatry. The three things are, it's kind of like to light a fire. You have a triangle where you need three different things. Well, this is pretty similar. So with Lunula, it can have the effect on the body that I can't. I could sit and massage someone's feet for hours, but it would not make me happy and probably not make them happy either. And I don't think it would stimulate the body quite in the same way. It's nice for, a little bit of extra stimulation there, but that's about it. But educating patients is where I come into it, and maintaining their nail care. Some patients, once their nails are back to normal, I never need to see them again because they can cut them and it's great. Other patients like to come in, have them checked. I often see, so I said earlier about skiers, I tend to see skiers just before they go skiing and just after they go skiing, and we just try and keep everything flowing quite nicely. Same with golfers. We tend to, I see them a lot more in the summer, just so that we can keep on top of things, keep their nails nice and short so their golf shoes don't cause too many problems. So there's all different things that you can do, and Lunula for me is just a great addition to my clinic. Even though I say patients that's the only treatment I use, it's not, it's part of the treatment that we do. So here's just a few case studies before I wrap up. So a simple damaged nail. This was a patient who came in September last year, so just a year ago. And they did have 4 treatments. I was quite amazed at the effect by the 3rd treatment. And then you can see the 4th one, it's all starting to sort of build layers on after the 3rd treatment. It's still quite fragile. And then they sent me a photo in May. I haven't heard from them since then, but very happy, back to normal. And they came in for a clinic review in May, and they were very happy. And yes, everything is good. And this was an interesting patient who wears gels, goes on a holiday an awful lot, and had Pseudomonas infection. So that is not necessarily fungal infection, it's water-based, moisture-based, bacterial, and you get that lovely green colour. Well, after 4 treatments, nail was back to normal, and that was October to March, so 6 months, 5 months, less than that in fact. And then she sent me a picture on the 4th of June last year. Haven't heard from her since, and she'd clearly not been wearing particularly great shoes because her 2nd digit has a bit of a sore on it, but her nail itself has grown up and is all very good. And hopefully she stopped having gels. And then this is the patient who sent me a photo today. So this has been near enough a year and a half nearly. This is how we started back in March last year. Inflamed proximal nail fold and medial side of the toe and a bit on the lateral side. The nail itself was fairly intact, but didn't really get down the side too much, as you can see. It wasn't particularly nice filing there. And then by the 4th treatment, you can see it's starting to sort of grow out. A lot of the paronychia has kind of gone a bit. Debriding the nail, it all looked quite nice and intact. However, we'll see later on that things started to kind of come back a little bit. So there was clearly still fungus down there. At this point, that far off, and I thought, okay, it's just a bit of discoloured nail. So in between every clinic appointment, we did a photo review as well and determined when she should come back. She was quite frustrated at this point. So this was 3rd of December. So we've been going since mid to end March. We carried out a 5th lunula at this point. So the last one had been several months, a good few months before. But you can see that yellow patch had started to spread, and then the nail was detached completely there, sort of almost leaving a little sinus there. 27th of February, starting to look better. You can just see a nice sort of border at the proximal nail fold, but still this didn't break. A little bit sort of like dead fungus rather than active fungus, so we kind of left it at that point, although maybe shouldn't have done. In hindsight, probably would have carried out another lunula treatment at that point, because this was starting to look inflamed again. And then in April, this again starting to kind of grow up. There was a bit of bruising around there, but the nail wasn't sitting flat. And then I took it off and it was still similar underneath. And then by June, so we did lunula then, and then in June, I saw her again, starting to get a nice border and the sort of hole was all closing up. Then her skin went funny, but the actual nail was looking quite a lot better. So I advised her at that point to deal with the actual skin, and she used Dactar for 2 weeks. And then today she sent me a picture. Skin is looking much better. the nail is all looking nice and clear. This is the last bit to kind of, before we start pushing all the borders out. And I think, you know, I've asked her to come in 6 weeks so we can reassess everything and see what's going on. And then I reckon it will take another 6 to 9 months to really grow out on the medial side and for everything here to reattach nicely. But we will keep a really close eye. Every 4 to 6 weeks or so, we are communicating with each other, either in clinic or by photo. So has Lunula helped to revolutionise my approach to fungal nail and skin health? Absolutely, without a shadow of a doubt. But it has taken me many years to see patterns of things and to realise that, you know, putting creams and topical solutions and things on nails don't really help them. They actually tend to detach the nail more, which then causes problems if you aren't healing the area at the same time or killing off fungus at the same time. But I wouldn't be without Lunula. In fact, as soon as I am without Lunula, I will be retiring. That's me done.
Hello, sorry about that.
Hello.
Kate was asking me some questions. Apologize about that. Martine, fantastic as normal. But I've been used to your webinars for quite a few years now, so nothing surprises me. Excuse my laser on my vocal cords, but I've been in quite a few calls today, so my voice is starting to go. Let me get through a few of the questions. There's a few that I can just answer direct. Can the GVL and EVRL lasers and the emerald improve the skin, pain, collagen, etc., including treating fungal, bacterial, and viral infections? Now, we've got to remember that the Lunula is specific to anything that involves the foot or the hand. As Martine alluded to earlier, you know, there's only a certain amount of space within the cage that you put it into, so you're limited specifically with what you can treat, more so to hands and feet. The emerald is specific for fat loss, as we know. That's what the clearances are. It's a continuous wave. We use the green light in the GVL, as everybody probably knows, to reduce pain and accelerate healing. So the green light, all of the lights are multifunctional. They have so many different areas they can work on. We wouldn't promote the emerald specific to skin, to pain. We have the GVL, the EVRL, the handhelds, the FX405, the FX series specific to that. So we try to compartmentalize each specific laser as to what we're trying to treat or the type of clinic that we are going to. So happy to give you further information specific to that. But when it comes to treating fungal nails, because the US have an FDA market clearance to it, the frequencies that they specifically use, they don't share. You could probably get maybe the FX405 and do some level of nail fungus treatment. But again, you know, Dr. Rarucha has a non-thermal high energy laser book looking at the frequencies. We could potentially look at that. When it comes to the GVL and EVRL, not really, because, you know, you're going to have to sort of hold the laser for 12 minutes over the nails in the nail bed area and potentially keep rotating it. And the reason why you would keep rotating it is because we noticed by activating, deactivating, activating, deactivating the cells, we get a better response rather than keeping the cells activated all the time. So you could just keep it stationary like that, but you're not going to cover as wide an area as well. So if you keep rotating around, you're able to cover a larger surface area. But I can expand on that more a little bit with email. I'm not sure, Martine, what part of your presentation this was maybe specific to, but you'll probably be aware. How about wine? Should they drink less wine or none at all? Can you remember what part of your presentation that was to?
Maybe the nutrition part. Everything in moderation. If you find that you have a reaction to wine, don't drink wine. I think the tannins in wine as you get older tend to cause various issues, but I'm not sure that fungus is one of them. if you drink too much wine, you're likely to fall over and probably damage your nails. So yeah, that might be a reason to stop drinking wine.
The next one we've already answered. I would like to know how it treats the face, but we've already covered that it's not the Lunula that treats the face. It will be more specific to either the FX series or the handheld series of EVRL and GVL. And again, they all have their different functions. A lot of the material we provide is very educational, so we try to not focus specifically on the brand of laser. We focus more on the different light and what each different light does. So if we're treating skin conditions or we're treating any level of pain, we're looking at this holistically. We're looking at the mitochondria. We're looking at the fact that if you use the red light and you want to make some positive changes to the mitochondria, then the red targets complex 4. So it will achieve good results on specific areas, but the green targets complex 3, the violet targets complex 1 and 2. So a lot of the time, if you're combining all 3 lights together, you get the most holistic treatment when it comes to mitochondrial health, when it comes to facial conditions, because each light has its own advantages. Again, more than happy to send more information about that. How many sessions are required for patients with all the nails affected with fungal infection of the nails who has no systemic issues?
I tend to carry out on toenails, I tend to carry out 4 treatments as a minimum, as a basic, kind of base level. Some patients will require more treatments depending on what damage happens to their nails during the day. You have to think about it like going to the dental hygienist. You go in, they clean your teeth, they take all the plaque off, and they tell you to come back in 3 months or 6 months or a year, depending on your circumstances. So once you go out, you may well clean your teeth and floss and use mouthwash, but you're also going to be eating and drinking. So it depends on what damage patients do to their nails. If their health is very, very good, most patients have 4 treatments. If they do have systemic issues, then depending on what those issues are, they may want to have more treatments down the line. But I tend to space out, as you saw with the paronychia patient, I do tend to space out treatments every 3 months or so afterwards. I don't tend to treat and press a button and press a button and press a button. I don't think that's a good way of treating. I think that gets the body lazy. I think the advantage of Lunula is that when you use it and you use it mindfully, you tend to give the body what it needs, the help it needs.
And I think that's a main area if we look back to when we started with the Lunula and you were the first on board. And even though we had the data from a very well-respected podiatric surgeon in Arizona, it was a case of learning as we go. And I think you're one of the main people who don't get too rigid with regard to your treatment programs. You see how things pan out over time. And I think you probably covered that in your presentation, but just in case you didn't, I think you said COVID taught you a lot about the type of treatment programs that you put together.
Yes. So when I was shut for 3 months, we are obviously thought, oh my gosh, when anyone comes back into clinic, I think it's going to be a nightmare. I had spoken to all the patients who were undergoing treatment, reassured them that we will sort it all out, even if we have to go back, it won't cost them anymore, blah, blah, blah. And, I was set for a pretty miserable time once I reopened. And what I saw was actually very different to what I thought I would see. And patients who had an active fungal infection, athlete's foot, stinky yellow nail rubbish under the nail plate, they still had that, and so we worked hard to get rid of it. Patients who actually didn't have that and who had either had a chronic infection that wasn't spreading, hadn't changed in years, or no infection at all, just damage, actually their nails were looking really good because they had a nice summer. They weren't wearing shoes particularly. They might have been going out for their hours exercise a day, but probably not. So sitting in their gardens if they have them. So it made me look at the whole picture a lot more, and it made me spread out my treatments, because and I was told many years ago that the effect of the 635, the red diode, lasts about 6 weeks or so. And if that effect lasts 6 weeks, why am I treating someone where I'm trying to heal damage, not kill off fungus, but heal damage? I shouldn't be treating them closer than 6 weeks between each appointment. And I've noticed a massive difference over the last 4.5 years or whatever it's been. Well, probably 5 years now since back in clinic. When you treat with time in between, it makes a really big difference. If you have a patient where they have an active fungal infection and there are really different clinical signs, then you want to start off really close together so that you kill off that fungus. You want to keep that hydrogen peroxide high. I don't know how long it takes the body to get rid of the hydrogen peroxide. I guess it depends on the person. But you want to keep that nice and high. And then once you think that the fungal infection is under control, then start spreading out treatment. So cases like that, I will do more than 4 treatments. But cases where it's mainly damage, I'll do 4 treatments.
Yeah. I think I remember a situation years ago, it was maybe 7, 8 years ago, where we had a workshop, and a lot of the time, and what you've just covered there, it's giving the patient's body an opportunity and their cells an opportunity to respond and to fix themselves. And sometimes if you're not getting the level of response you're looking for, there has to be some sort of medical condition or reason, or why it's not responding. It's nothing to do with the laser. The laser does what it says it does, but it's something's not working.
So I think it is to do with the laser sometimes, in that it's being overused. And I think that's really important. I think it's a brilliant tool, but you have to use it wisely. There's no point in thinking, oh, well, it's a really lovely little toy, I can just press the button. Do that, you will get 50-60% effectiveness. Use it in the way that it really helps the body, and you'll get 80-90-95% effectiveness. I think, it's very much about thinking about what you do, and that's no different to most things in medicine, that there's a reason why there's certain doses of things, and why certain procedures are carried out and with certain time frames. It's because the body needs to actually do what it's meant to do. And if you don't allow it to, you're going to end up in trouble.
Yeah. Well, what I was alluding to there, I don't know if you remember, it was the gentleman that said he did 42 treatments, so 1 per week.
Not only do I remember it, but I still have flashbacks. I do remember. He did.
Always saying, well, after the 4th or 5th treatment, if it's not showing you any level of response, there's something else going on there. And to give the body's cells and mitochondrial function an opportunity to fix itself over a period of time. So I think patience is the key a lot of the time.
Correct. 100%. 100%.
Okay, that's been answered. How often do you treat them? Another one, you mentioned something before about dental treatments. One of the questions that came in was specific to continuing treatments thereafter. I don't know if you do it or it's just other clinics, but obviously when you're treating fungal nail infections, you do your 4 weekly treatments. Then you keep an eye on the situation to see how well the nail's responding. And if you need to do another treatment, you wait 2 or 3 months to do it. We have some clinics now, especially for the nail and nail bed health, that they're offering clients either monthly or bi-monthly nail maintenance treatments to try to keep the nail and nail bed healthy. Is that something you've implemented into your clinic, or have you just sort of kept to what you know?
It is and it isn't. So the reason I say that is because I have always had a conflict about, I have a treatment package price for 4 treatments. That's where we start off. I don't have any other sort of package price. I then go on to a maintenance program. But that is kind of a review and maintenance program because everyone is so different. So I then have a cost for patients to come into clinic for nail care, and an additional cost, which is a fairly low cost because it's only 12 minutes of my time. I have 2 lasers in each of my clinics to carry out Lunula if we feel that that's a good time to do it. So I don't have a formal sort of program, but when I start treating patients, the deal is that, you know, in my head, I'm looking at them being around for about 3 years. That doesn't mean I'm going to necessarily see them for 3 years. It may be that I see photos, and it may be that after, you know, 18 months, everything is back to normal, and that's wonderful. But for patients who have, you know, a fairly severe issue on either one or several nails, it's a long-term thing, and that does include other further treatment sometimes to give. And in fact, I have them on my software as Lunula Boost. You know, that's what it is. It's to give a boost with Lunula. So yes, I do that. I just don't do it in a rigid sort of way. I look at each patient individually.
That's a great way to explain it. I mean, you know, what we use, especially on these sort of lasers, we're doing a lot at the minute with longevity and brain health, is, you know, I always say, you know, we've got everything that we need in our bodies to live a normal, healthy life. But as we start getting older and we have bad lifestyle, we have, you know, the preservatives and additives, etc., that we get in foods, alcohol, which a lot of us are guilty of drinking too much from time to time. It affects our cellular function and our mitochondria's ability for our body to treat itself. So sometimes it's like it just needs some inspiration. So when, you know, you're firing the lasers like I'm doing at my neck at the minute, it's passing these high energy photons into the body to be absorbed by the mitochondria of the cell, to try to allow your cells and your mitochondrial function to perform how it used to before we started making these bad lifestyle changes that we talk about. The question I was going to ask before was, do you find patients see the value in ongoing nail health, similar to how they view regular dental checkups or skin treatments?
They do once you've explained it to them. Absolutely, they do. Before explaining things to patients, they think they are just coming in because they have a fungal infection, even though most don't have a fungal infection, and most will be seeing me for a long period of time. It's nails are weird in that they are completely overrated in terms of using gels, and, you know, the market that's out there for, you know, beautiful nails and things, but they're completely underrated in terms of the actual health of the area. And there's very little online about it, and there's very little, you know, I went over all of my university notes a few years ago. I learned, you know, I did a dietary degree, I learned very little about nails. I see many doctors in all different medical disciplines, and none of them learn a damn thing about, well, they didn't really learn very much about feet at all, but they certainly learned nothing about nails. But actually, nails protect your nail bed, and yes, we can do without toenails, certainly, but aesthetically, they look a lot better if we've got them sitting there. And like hair, like skin, nails, you can ruin them. You know, when you're stressed, they don't look particularly great, they don't feel particularly great. They respond to bodies, they respond to lifestyles, they respond to health or lack of it. So once I explain to patients that, you know, if you go and get your eyebrows threaded every 6 weeks and you can't cut that big thick toenail, why aren't you having it filed down professionally every 6 weeks? That's when they start to think, oh yeah, it is something that should be done and I should look after them. And then we get talking about foot health in general, which is obviously what my profession is all about.
Okay, I was just busy replying to one, which it was basically saying, you know, with regard, it was a customer who's been with us a long time. I thought we were going to cover a little bit more about the Lunula for things like wound healing and reducing eczema. Do you use the laser for different forms of wound healing, post-operative, or do you just stick to your fungal nails and your your nail and nail bed health?
Well, it's a bit difficult because the name of my practice is the London Nail Laser Clinic. So generally, that's what people come to me for. However, I do have a few patients who have been recommended to me by friends, family, whatever, not because they've got nail problems, but because they have other issues. So like I said before about chilblains, you know, like I wouldn't dream of being the person who treats a patient who has an ulcer just using a Lunula. They have to be in the right environment with, you know, regular redressings. Certain wounds require certain care. So, you know, yeah, Lunula would probably help speed up healing with things. But actually, if I don't have the time to see someone every few days to change a dressing and to carry out another treatment, then that can't be the treatment of choice. So personally, no, I don't really do a great deal of wound healing. Yeah, I see patients with all different things, with eczema, psoriasis, and we use Lunula. Has a good effect sometimes, but when you've got you know, something that's going on with your own autoimmune system or your own immune system, and psoriasis, things are autoimmune disorders, we have no power over these things. You can't change it just by saying to someone, change your footwear or whatever. So, you know, we can use Lunula when there's a flare up or, you know, periodically or as required, but I wouldn't use Lunula as the, you know, oh, this is going to cure your eczema, because actually that's not how it works. It may help it, but it won't stop it coming back. And I think that's the thing that you have to explain to patients, that it's a brilliant tool to help at that time, but it isn't something that will necessarily stop you ever having a flare up.
And it goes back to a question I answered actually while you were talking earlier, when we're looking, and I said this before, you know, when we were, after you finished your presentation, that we have specific lasers and we harness them specific to treating specific things. Now, the Lunula was originally manufactured and developed specific to treating fungal nail infections because it was becoming a bigger problem. But when it comes to things like treating eczema or treating psoriasis or treating a lot of, you know, skin type conditions, a lot of our clinics would obviously tend to use the likes of the EVRL, because you are limited with the Lunula because it was specific to hands and specific to feet. So in case you didn't see that answer, I'm saying a lot of our clinics who treat the skin, we try to train them to treat it very holistically, especially if we're talking about facial skin conditions. Everybody's aware of probably LED masks and a lot of these sort of things which they use for facial skin conditions, and they work to an extent, but a lot of what they're doing is just putting a plaster over an issue, a plaster over a crack. It's not getting rid of the source of the problem. We know the source of the problem with a lot of skin conditions comes from lifestyle, from dietary things, but we also know a lot of it comes from this area here, from the gut. So when we're doing a lot of these sort of treatments, we're not just treating the face, we're treating the vagus nerve, because the vagus nerve lives to the gut. The gut, we know, is the second brain. The violet light, because it's antimicrobial, works very well on the gut, on bacteria, on infection. And with the healing properties of the red and also the green light, that would work very well on that. So we try to look at these sort of issues holistically, rather than thinking, tell you what, let's just put some laser diodes in a mask and let's just shine it at the face. It's not quite as simple as that. It's more of a look at the bigger picture. So I hope that helps answer your question. Thanks for the informative talk, Martine, from somebody there. 4 treatments, again, when we're talking about the 4 treatments, as I'm sure you've alluded to, we've got to look at the individual patient. We've got to look at the human body. We've got to look at the fact we don't all react the same. So a lot of it is just being patient. It's being clear with your patients when you're treating them that we're going to start off with an immediate, weekly program once for 4 weeks. Then we're just going to see how your body responds to the treatment. When we've got 1, 2, 3 months after the treatment, If we feel like you'll need more treatments, we'll bring you back in to administer more treatments. But we've got to see how the nail and the nail bed actually respond to the original program before we actually have a treatment pathway beyond that. Would you agree with that, Martine?
Yeah, but everyone is different. My 4 treatments is a baseline. If you start using Lunula, it's not going to do any harm. You've got to play around. Until you use it, you're not going to know how the effect or what the effect it has on patients. I can give webinar after webinar after webinar. That's still not going to, tell you everything you need to know. I've been doing this for years. And the fact that I still enjoy treating patients, I still get really excited, like I did this morning when that patient sent a photo through, and finally she, her email was, "You can see such a difference." And this has been a year and a half, but we've persevered. And it's about persevering in some cases, and it's about treating just enough in other cases.
No, yeah, I agree completely with that. And I think this is what we try to provide. And Martine is the Lunula clinical consultant. We have a Lunula laser Facebook group, which Martine controls. And as much as we try to make it interactive and try to get everybody to engage, she's always keeping an eye on it. So it's not just for clinics who want to share their successes, but it's also for clinics to share any cases that they may be struggling with, to try to get some input from their peers and eventually from Martine, who can try to help with a pathway forward. Because as we know from medical treatment, in every medical treatment, not everybody responds the same. We would hope a high percentage of the patients would respond how we expect them to respond. But again, there are anomalies, and we're there to support you throughout. So on that note, Martine, thank you so much for your time. I know you've got to go to your yoga class.
I'm going to yoga.
Everybody, no matter where you come from, we really appreciate you coming on. And maybe again, the next one we do, we can do it on Lunula, or we can just do it on the red and violet. Like, we can look at the many different things you can treat with it that you can't necessarily do with the Lunula, that needs to be done with the likes of the EVRL or the FX405. So keep sending the suggestions in, guys. We will read through every one of them if there's any topics you would like covered in the future, and we'd be more than happy to put something out there for that. So Martine, thanks again, really appreciate it. My voice is just about survived, but I always say, if it's good enough for John Bon Jovi to work on his vocal cords, it's good enough for me.
Your singing voice is nothing like his.
Yeah, you can be testament to that, I'm sure, as well. Yeah. Thanks a lot, everybody, again, and take care, and enjoy your evening. Thank you.
Thanks. Bye.